Good afternoon, everyone. This is County Executive Pat Ryan. Thank you for joining us on another beautiful day. Hope you're enjoying your Thursday. Today should be a relatively straightforward update. We're going to talk about the COVID situation, which remains good and stable. And then we're also going to talk a little bit about our ongoing work to address the opioid epidemic in the midst of the COVID pandemic, which has of course, exacerbated and accelerated that. So starting with COVID and starting with the numbers, overall we remain in good shape. I'd say we're holding steady, holding tough, I think is a good way to put it. We have had a total of 2,185 cases. Whoops, I'm sorry, I'm looking actually at outdated numbers. We've had a total of 2,202 cases with 1,980 recovered, and thankfully have held steady at 94 fatalities and continue to do that for going on 2 weeks now. In terms of our hospitalization numbers, we are also holding steady there, and as you can see from that line at this point, we're pretty much steady right around between 0 and 1. Right now we have 2 individuals hospitalized for COVID-19. One remains on a ventilator, unfortunately, but is hanging on. In terms of active cases in the county, we are at 128 active COVID-19 cases, slightly up from 2 days ago, but very much, as you can see from the graph, within the norm that we've been at for the last few months. And we anticipate staying there at this point as we see the trend line heading in pretty much that same direction. The critical metric that I look at to really see how we're doing both at a moment in time but also looking forward is the number of new positive infection rates, positive cases, and the positive infection rate in the county. So right now this number remains very good. Over the last 48 hours, we have had 14 new positive cases out of 2,132 tested. So that is a 0.65% new infection rate. And also just interesting to note that those are near record high numbers of tests being given. So in the last 2 days, to give over 2,000 tests also shows that we're continuing to maintain and even build our testing capacity, which is very important to make sure we can keep our finger on the pulse of how we're doing with COVID and how we're doing with any possible new emergence of clusters. So again, being at that 0.65 is encouraging, and we hope to stay there. Hospital capacity, looking out forward in the long term, we remain in a good shape here, and actually continue to slowly up our capacity if needed. And as I said, 2 individuals right now hospitalized. So how do we continue to keep things the way they are? And we are continuing to be able to slowly and carefully reopen things. We had encouraging news within the last 48 hours for our agriculture and agritourism part of our economy, which is a big part of our economy here, particularly heading into the fall. Good news that they will be able to open with some reasonable common sense restrictions, but to get them open, to make sure that as folks are looking to come, experience the Hudson Valley, both locally and tourists that want to come up, that we can do that in a safe and responsible way and make sure we support those businesses. That was a positive development to get that news from the state. As we continue to do those things and carefully and slowly reopen and keep open, this all only continues to work if we each do our part in terms of personal responsibility and awareness, in terms of with our colleagues and our friends, that we each do the small, but I know sometimes frustrating things needed to slow the transmission and stop the transmission of COVID. And those big 3 things are, as we probably all know by this point, wearing a mask, maintaining social distance when you're around others, and washing hands and using hand sanitizer. Relatively simple, relatively painless, things that we've been doing that have worked and kept us in this place. So please, please keep that up as we move forward. And if we do, I'm confident we'll remain in a good place and hopefully get out of this situation sometime soon. I know we're all really hoping for that and working towards that. Shifting gears a little bit, I want to, as I mentioned at the beginning, talk about some of the other things happening in the county related to COVID, but also already occurring was the situation with the opioid epidemic in Ulster County. And I talked a little bit about this on Tuesday, but I want to give some updates and also a little bit of a preview of where we're going next year with our efforts to combat the opioid epidemic. As I talked about on Tuesday, we are in the midst of a COVID-19 pandemic, but we cannot, and I have not, and we have not let that be an excuse to lose sight of the opioid epidemic, which is absolutely still having tragic and heartbreaking consequences here in our county for individuals and families. Unfortunately, this year in 2020 through July, we've seen more fatalities due to opiates than we had in all of 2019. And we are painfully aware of that and doing everything that we can to get that under control and in check. One of the main reasons that we know this is happening is the relatively new introduction of a much more lethal form of opiates, a synthetic form of opiates called fentanyl, which is 50 times more lethal than normal street heroin. And in the last year, of the 38 fatalities that we have experienced as a county, 34 of them were definitively linked to fentanyl, and we believe the others were likely due to it as well. This is a type of drug that, as you talk to experts and doctors, literally a few grains the size of what would sort of fit on my pinky, are enough to kill a full adult human in such small quantities. And we have seen massive volumes of this drug coming into our county and really into the whole region. And that is a big reason, along with all the pressures of COVID, that we're seeing such a perfect storm of devastation from opiates. So to address that, on Monday, I declared, for the first time to my knowledge ever in the county, a public health emergency specifically related to fentanyl, to make sure that we're all aware of the risk, that we are mobilizing all the different assets and tools we have to work together and really have all hands on deck to address the opioid epidemic in the same way that we've been able to marshal resources to address the COVID pandemic. We have to bring that same focus and unity of effort on this problem, which is also costing far too many lives. Some positive developments on that front, in addition to marshaling additional resources financially, which we'll talk about in a moment. Our law enforcement leaders, led by our county sheriff Figueroa, as well as our district attorney Clegg, and our urgent team, which is a countywide team focused on narcotics interdiction. On Tuesday, they announced the seizure of the single biggest amount of heroin and fentanyl in the task force's history, over 10,000 prepackaged, ready to be sold and used bags of heroin and fentanyl. And if you just think about the number of lives that were quite likely saved, at least in the short term, by that seizure, the number of people that could have possibly used and been harmed by those drugs, that is a big step. It also takes a fairly senior level distributor off the streets who's being held and will be charged with that offense by the district attorney. So we know that there is a significant volume of these drugs coming in. This was a significant step to interdict that, but we also know it will continue, and we have more work to do on that front. So I'm confident that all of the different members of the team necessary to do that understand how serious this is and are working very, very hard to that end. In addition to interdicting, though, we have to get ahead of this. We have to work on the prevention and the recovery efforts, which we've been ramping up over the last few years here in the county as part of a more concerted effort to tackle the opioid epidemic. One of the things I'm excited to do today, believe it or not, we are less than a month away from me proposing and presenting our budget for next year, for 2021, which I'll do in early October. So we've been doing that work to prepare that budget, and today I'm going to give just a preview of one of our first budget initiatives for the, believe it or not, the 2021 budget, which we've been working on for the last few months. So the first budget initiative for 2021 will be a renewed and amped up effort to make sure we have adequate resources to really address the opioid epidemic, particularly to try to get ahead of it with education, prevention, and recovery. So in the 2021 budget I'm proposing, we will be allocating $670,000 to opioid use prevention in the 2021 budget. What does that look like? What type of programs will that include? Here is a not completely exclusive, or completely inclusive, but a list of some of the key areas that we'll be focusing on and using these funds to address. Education, particularly, of course, for young people in the community. Outreach, delivery of medication for high-risk populations, safer dispensing for opioid practices, and most importantly, I think, providing critical social supports to those already struggling with opiates in terms of housing, childcare, and transportation, which we know are often barriers to getting through and on the path to recovery. This funding will also continue to maintain support to the high-risk mitigation team, which we've talked about before, which is a comprehensive program with care managers for individuals that are already struggling to make sure that they're getting really comprehensive, personalized, high-touch support as they're on the path to recovery. So I'm really proud that in next year's budget, we are going to meet what we know is a growing need to continue to tackle this epidemic with a significant commitment, even in a time where we are under financial strains as a county, and most governments are at all levels. This is something we have to invest in and that we will continue to invest in. And to that end, since I've been in office, this additional funding next year will bring us to a level that is unprecedented of over $1 million, $1.3 million specifically dedicated to opioid prevention. And we know, look, that hasn't proven enough. We've seen the numbers go up. So it's not just about how much money, but it's about how wisely are we using it? Are we being creative? Are we engaging the right partners? And are we getting all the different pieces working together so that those individuals that are at that moment of crisis and challenge, that we really are there, that we have their backs, that we have the families of those individuals' backs. So that's the mindset that we're bringing. And we'll continue to roll out in the coming weeks as we get closer to early October when we present the budget. We'll continue to roll out some previews of what will be in that budget. But I think it's important for everyone to know that I think in a good way, our experience during the COVID pandemic has really illuminated many urgent needs. And we've talked about this before through our recovery task force. So now as we look at our budgeting of where we're going in the future, we will absolutely be factoring that in and making sure that we're learning from what we're experiencing now, that we're seeing that the vulnerabilities and the gaps that were exacerbated by COVID, and many of which were already there, that we're really tackling them head on and providing adequate resources to keep everybody healthy and safe, and really to improve the community. So more to come on all of those fronts. That's really it for our update today. I thank you all for tuning in. As always, I want to thank all of our essential workers that have kept us safe and healthy through this, from our healthcare workers to those working in grocery stores and getting us packages and getting us mail and getting us medication, to, of course, to first responders and law enforcement. And I know as we get back into school next week, to our teachers and educators and faculty, and so many more, thank you. Thank you for what you've done. There's more work, and we're going to continue to rely on you. But please know that the 180,000 residents of this county really appreciate what you've done and the risks and the sacrifices you've made. And I definitely do, and I know my family does too. So thank you. We will see you next time. Will be Tuesday at 2 p.m. In the meantime, if you need anything, you can always reach out to our Recovery Service Center. We have a great team standing by. That number is 845-443-8888, or you can go to our website, send us an email. Just know that, again, we are here in these challenging times, not just for COVID, but really for any of the challenges you and your family are facing. If we can't get you the immediate help, we will find someone who can. So until next time, be safe and healthy and stay resilient, and we will see you soon.